Okay. Hi there, everyone. I'm Malik Steward, and today I'm doing my biomedical ethics exam number 2. And in the full exam, I will be answering the questions about the ethical permissibility of voluntary euthanasia, along with 3 arguments for and against it, along with providing 2 definitions of determining death, along with issues that could complicate potential organ donations with it. All right, so first question I'll be answering is the ethical permissibility of euthanasia. So the first thing I want to do is define voluntary euthanasia, which in this case refers to the practice of ending a person's life intentionally to release suffering or with the explicit consent of the individual. So an example of this might be if someone is in late stages of cancer, in which case they cannot recover, or the chance of them recovering from operations or chemo is leaves them in a worse position than they were before the treatment. In that situation, euthanasia could be an option for that patient, since it allows them an out and allows them to have the ability to express themselves freely. So, usually, those who are for euthanasia are based it off of utilitarianism along with virtue ethics. For utilitarianism, one could argue or make the statement that for the greater good of all in this case, one should, I won't say off themselves, but rather voluntarily euthanize themselves to prevent further suffering from those around them, and which includes not only physicians and practitioners, but also loved ones and even themselves in this case, if the condition results in them in a worse position than they were prior to the condition developing. Yeah. So, but that's not the only argument for euthanasia. It's also the argument that, again, due to personal choice, the euthanasia or voluntary euthanasia allows one to have the freedom of choice and the freedom to express themselves. Since at the end of the day, as a physician or as a caretaker of said patient, one ought to take notes or take the well-being of that patient into consideration. So, in the case of the patient who, if they have like late stage cancer, or in some cases have a mind altering condition such as like dementia, Alzheimer's, or a non difficult to recover TBI or traumatic brain injury. In that case, perhaps euthanasia might be an option to consider in that case. Also, in addition, if one wishes to reduce suffering or to reduce overall again harm from people in both themselves and those around them in general, then that euthanasia can be an option in this case. In addition, it's also a good way for those who are in minority positions to also express themselves freely. Oh, and also it allows resource allocation as well. So in this case, if so, with euthanasia, it can allow physicians to focus their resources onto other patients. In this case, however, in the case of against it, there's it's also the potential of abuse. So in situations where the patient's well-being, or I guess the ability to recover is uncertain, there might be situations where physicians may feel like their patient may not recover or fully recover. However, they may not also have the resources to, or they do not may not have the information to fully come to that conclusion. So in that case, they might push or slowly but surely lean that patient into that position, or I guess coerce them into that position as a, maybe a possibility. There's also the potential of that being a slippery slope in certain cases. So this again, I think as I mentioned before, in certain situations, minorities could also be more susceptible to voluntary euthanasia if the condition is so severe, along with other potential situation or other potential conditions. For example, might be that again, if someone has cancer, late stages of cancer, and that person may or has some form of intellectual disability, then that could lead them to being in a more vulnerable state compared to that who of a person who may just be neurotypical in this case. Or in certain cases, it may also result in them, or I guess result in others having the perception that the respect of those who I guess whose only choice is for euthanasia to I guess not necessarily it's I wouldn't say more accepted, but makes them people more cautious to consider that option as well. In addition, if one were to follow the deontological or deontological viewpoint, it could be one could argue that it is one's duty to keep the patient alive or as well as possible. So killing in this case would be inherent wrong since the duty of keeping that patient alive is not fulfilled in this case. So therefore, it would euthanasia will not or would not be the option in this case. And which leads us to the next point, which is the definitions of death, or in the case in the context of the medical field. So there are two definitions that are well well accepted, which is the cardiopulmonary death, or also known as cardio death in this case, which is basically the when a patient ceases to have any type of circulatory or respiratory functions, which basically means that it, the patient has no form of heartbeat or shows any signs of movement in the heart in this case. And the other definition is brain death, which is considered the ceasing of electric not electric but electric activity in the brain, including the brainstem. So in this case, these tests usually revolve around using cranial nerve reflexes to determine that. But I imagine there will be also other tests to determine that as well, such as maybe MRIs or fMRIs in this case as well. However, these two definitions do run into issues if observed thoroughly. For example, those definitions can conflict with one another in this case. So usually or typically patients or those loved ones of patients typically assume that death is more of a cardio based or view it in a more cardio based way, where if the heart is not ceases to move, then that patient is therefore dead. Which of course there's always exceptions to that, but usually that's what most people go about when it comes to determining if a loved one is dead. However, in cases where it's more brain death is involved, it could lead to situations where patient loved ones of patients assume that there's a fighting chance or there's a potential of said patient continuing to live or be alive in this case, as even though they may have heart movement, they there's no movement or electrical activity in the brain. So that could lead to situations where patients are kept alive longer than they need to, or able to live, and this could lead to complications with organ donation. As again, it's not a piece of steel or a piece of metal; it is a living being that's a part of a living being, and thus needs oxygen in order to live. And if without that said oxygen, this could result in the viability of the organs deteriorating, which in turn could cause more complications since now these potential organs that could save other people's lives are also, I guess, running on a ticking clock in this case. In addition, which I guess relates back to timing of death declarations, because again, due to brain deaths being more difficult to determine, it could lead to situations where the death of a loved one takes longer, or in some cases shorter, depending on like the context of the situation or the context of the patient. So it could lead to situations where the death is considered too early, even if that patient has a fighting chance or a potential of to live or survive the incident. But it's also runs the possibility of it also being too late into it runs to the issue of the viability of organs being questioned in this case. In addition, societal bullies can also run a problem in this, as again, due to the fact that there's limited knowledge of brain death in this case, then people can assume that the cardio death is I won't say only way a person can die, but it's the main way that a person dies in this case. So as a result, it's those are potential issues of cardio death, or not cardio death, but the potential issues of the definitions of cardio and brain death in this case.